Here at Felgains, we have a passion for reducing the impact that falls have on the NHS. So much so that we have a vision, or maybe you'd call it a strongly held belief, that we shouldn't be sending ambulances out into the community to respond to minor or non-injury falls. Now you may say that's a big ask, but in this video we're going to explain what the problem is, what our solution is, and how we help you implement this solution, and subsequently the results that other NHS organisations have seen from this approach.
People who have fallen but not sustained any injuries are usually triaged by the ambulance service as category 4, so they will typically wait hours for help. Ambulance call-out times are currently at a record high level, further increasing the length of time a fallen person will be waiting on the floor. More than 1 hour on the floor is called a long lie, and this is associated with serious complications, such that even if there was no initial injury from the fall, a long lie will cause harm.
We were seeing an increased amount of people, unfortunately, going into hospital from ambulance complaints from care homes with falls.
We found that staff were calling the ambulance on a continuous and regular basis, really.
So before we had the Razor 2 and Helpful would just purely be a judgment call, but then it would result more than likely in a 999 call.
Effectively, the Felgains Falls Solution is how we work with organisations across both health and social care to implement falls response that enables better care for persons who fall. Now, this does typically involve the supply of the Razor alongside Helpful, which is our post-falls decision support tool. Now, we totally get that these projects can be complex and sometimes quite daunting, so we view it as our responsibility to take the weight essentially off your shoulders. So from the initial scoping through to the implementation and tracking, we guide and support you through the process to make sure your project has the best chance of success.
As part of our sort of Mid and South Essex approach, so we purchased another 70, got funding for 70 more Razor chairs to roll out across care homes, and we've done that in partnership with Felgains, who have supported the training, the videos, and also any sort of data monitoring has been supported by them, been really helpful, and also in partnership with our community nursing services, the care home support teams have been on board with this.
We have worked with a number of NHS organisations over the last few years, so we have learned what works and what doesn't, and understand how they have navigated some of the following challenges. How to understand which care homes to include in the project, ensuring equity provision, making sure care homes are on board and understand the objectives of the project, how to ensure maintenance of the equipment, and how to fund the project.
Now, implementing this approach has helped numerous NHS organisations to reduce ambulance call-outs and prevent unnecessary hospital admissions. By providing a solution that enables better and more dignified care, we are effectively helping reduce system-wide pressures on the NHS.
Last year, when we did a pilot over a 12-week period, half of those were fallers, and out of the fallers we managed to keep 80% of those patients at home, providing that holistic intervention using the Razor chairs, and providing that kind of hospital at home approach, and that onward referral into community teams.
We have reduced ambulance attendances at hospital, we've reduced ambulance attendances at care homes, so there is a significant amount of a reduction from that point of view alone. So from a system-wide basis, hopefully this will have play a part in helping to sort of reduce that flow.
We see a very, very positive experience from our patients, and we've seen the positive return of being able to not have to send ambulances, so that in effect gives us more ambulance hours back into the system.
Obviously the Helpful gives us that little bit more reassurance when it comes to our decision of moving.
We've seen an 84% reduction in ambulance call-outs to care homes that have been using this Helpful app with the Razor chair, which is a phenomenal achievement so far. But also, really importantly, there's been a reduction in the no abnormality conveyance rate, and that has reduced from 27% to 0% for these care homes using the Helpful app. So that really does save a huge amount of time. We've also seen an 80% reduction in the amount of ED attendances for care homes for falls with the ones using this particular system. So right across our board, we're making a really big change here with a really simple tool.
Obviously, the needs of every commissioning area are unique, so we're well aware that we'd need to tailor the package to your unique requirements. So if falls-related hospital admissions present a problem you're looking to solve, let's chat. We'd love to discuss your needs in more detail.